Yes, they do. So I'm right. Okay. So it's important to create healthy environments to make healthy choices. That was one of the things that we believe we could say without any reservation. You got to have a healthy environment. Let me give you an example. As a doc who's taking care of patients with diabetes, people who were low income, I might say to Mrs. Gonzalez, it's really important that you incorporate more fruits and vegetables into your diet for a whole host of reasons. There's the fiber issue, there's the vitamin issue, there's that in place of other things that are just kind of calorie dense but nutrient poor. And Ms. Garcia would say to me, I hear what you're saying, doctor, but I can't afford it. When I go to the store and what I'm faced with is buying canned X, Y, or Z versus fresh fruits and vegetables, which may go bad in a day or two, and I'm going to have to throw some of it away, I just can't bring myself to do that. And I worked in settings, and I know that some of y'all do, and I know that Tulane provides care in settings where not only that same Ms. Garcia may be the primary caretaker for her 3 grandchildren. And so on top of everything else, she's trying to make her Social Security check stretch for herself and her grandchildren. And again, an apple for 40 or 50 cents versus some other things that are more filling and around which there's not going to be any arguing. You give a child a potato chip, unlikely to say, no, I'm not going to eat that. But Catherine and I, every night, we go through we have a daughter, Maya, who's an obstinate little girl, and will say, no. No is her favorite word around food. She usually doesn't prevail. She doesn't usually prevail, but I bet you if I put potato chips up there, there'd be no no's. And the no's around other things. So not only is it cost, but also if your grandma trying to do that, you may just want to go down the easy path. We have to create environments where it's easier. We can't deal with the child who's going to say no, but we can make it easier for those fruits and vegetables to be made available. And many children live in places where the unhealthy choice is the easy choice. Staying indoors because the neighborhood is believed to be unsafe to be outdoors is one of those kind of situations. We're not necessarily talking about living next to a factory that's spewing smoke, because if you live next to a park where there's criminal activity going on, no matter how beautiful things are around you, you just might as well be living next to that smoldering smokestack because you can't go outside anyway. We did talk about health equity, and that is that it is important to understand that the fair distribution of health determinants, outcomes, and resources is part of what we needed to talk about. You cannot talk about childhood obesity and not talk about social determinants of health, and while we didn't address that directly, you will see in the recommendations that we did address that a little bit. Now I have one of these because I've forgotten. We came up with some principles, guiding principles, that were really some pretty cool principles. Childhood obesity prevention is crucial to the future health of the nation. The creation of environments that support health is essential to preventing childhood obesity. Local governments are essential. Eliminating health disparities and achieving health equity should be priorities in any childhood obesity prevention effort. So we were intentional in saying you can't just have one set of kids in our society who maybe have the resources moving and eating well. This really has to be thought of across the entire spectrum of our society. Some of the approaches in general, and I'm coming to the recommendations. I will tell you and I will point out, there is a person here representing local government, and thank you very much again for being here. Chapter 2, and she got a copy of the book. Chapter 2, Act Locally, has actually some steps about some things that a community could do. 1, conduct a community assessment. 2, involve constituents. 3, identify top policy priorities best suited to local conditions. And you realize none of that says childhood obesity necessarily. We also understood if childhood obesity is not the most important thing in your community, people like me are not going to make it the most important thing in your community. So we've got to build relationships and get people to that place. I will tell you a story. When I was the local health officer in Austin, Texas, speaking of smokestacks, there was a power plant in a neighborhood in East Austin that was spewing a bunch of smoke. And an organization called Poder, People Organized in Defense of Earth and Her Resources, had huge concerns about this power plant, and they did a community health assessment. And then I met with them. And when I looked over the community health assessment, it turned out, and I'm laughing a little bit, it turned out that in that instance, while Tulane thought the most important thing was the smokestack, people in the community thought diabetes was the most important thing in their community. And the truth is, we did some further analysis. What we were able to demonstrate to Tulane was what was coming from the power plant paled in comparison to what was coming from I-35, the interstate that goes right by that same neighborhood, and from 6 o'clock in the morning to 9 o'clock in the morning, and from 5 o'clock in the afternoon to 8 o'clock in the afternoon, the things were off the chart because of cars, not because of the smoke, not because of the power plant. Now that doesn't mean the power plant wasn't an issue. It just means that it was background compared to the real issue. But we were able to refocus Tulane in a community, some community work around the issue of diabetes and what causes diabetes. But that was the result of saying, let's hear what you have to say, let's listen to what's going on, let's mutually identify what are issues of concern, and let's figure out what are some strategies that we can go about to address those. So, recommendations. One thing we recognize, not all, one size does not fit all. What works in New Orleans may not work in Austin, Texas. What works in New York City and in Seattle probably doesn't work anywhere else in the United States of America, because those are cities that are at stages of evolution, trans-theoretical evolution that's very different than some of the other communities that are trying to figure out what to do. The South behaves very different than the rest of the country, and we could spend a whole lecture talking about Texas, Louisiana, Alabama, Mississippi, and how you got to understand, you know, we talk about cultural competence, you got to have political cultural competence to sort of be able to play in the South. People from the North just say, well, we did it, and you know, you don't understand. It's a whole different, lawmaking is a whole different thing down here in the South than it is up there where you guys are. Grassroots organizing is something that works in other parts of the state, of the country, doesn't always work in the South. It's important, you got to have it, but you got to have some other people doing some of the heavy lifting. We had 15 strategies and 58 recommendations, though I can't go backwards, but they were organized around basically increasing healthy food, decreasing the consumption of less healthy food, marketing so that people understood what to do. I think we would all agree, if we could, I would assume we're in the same club, if we could provide healthy messages at the same intensity as the messages about things that aren't necessarily the healthiest for you, maybe people would eat healthier just because they at least have equal amounts of information. And then on the physical activity side, increasing people's ability to be physically active, decreasing screen time. And let me be clear, some of us with gray hair, no hair, or dyed hair, sometimes will say, well, when I was a kid, we spent all our time outside. I promise you, when Diego and I were kids, we went outside because there was no reason in the world to stay indoors. TV, there wasn't that much to watch, and it was like 3 channels, and during certain times of the day, no one would watch that. And the most interesting thing you could do, in my house anyway, sometimes was watch my mom either cooking, ironing, or sewing. Not that she did any of those things, I'm saying it figuratively, not literally. So, not meant to be sexist, just meant to be, and my dad was at work. No matter what it was, if it was your dad, he'd be flipping, couldn't flip channels, that was pre-flip days, right? Couldn't even be watching sports. It was more interesting to be outside. And if we had the toys back then, the video toys that we have today, no one could have dragged us outside just like our own kids today. So, let me, oh man, the top arrow, the up arrow. I don't have a keyboard. I do have a keyboard. I lied. Mr. Magoo! Okay, so I'm going to run through these recommendations and then we'll stop. There were 58, but we looked at 12. We came up, so we looked at 58, and then we found we needed a way to sort of concentrate attention on some things. We went through a process where the committee members literally voted on a number of criteria, and these 12, it was a nominal voting process, these 12 stood way out from the others. So attract supermarkets and grocery stores to underserved neighborhoods. You know that one of the issues is affordability and availability. If the supermarket's not there, forget about it. You still have to get into the supermarket to be able to make good choices. Require menu labeling, that's covered in the Affordable Care Act. Mandating and implementing strong nutrition standards for foods and beverages in government-run or regulated after-school programs. What does that mean? That means the same kind of things that we're doing in school, we ought to be doing in the after-school environment. We ought to be doing in the preschool environment. We ought to be doing for kids before they enter K through 12. Here's a great one. I love this one. This one is the one that says, hey, why don't we just drink water? And oh, by the way, why don't we just drink it out of water fountains? Because the truth is, these bottles are, they're choking us. But you can't drink out of water fountains if they're not around. So the idea is, why don't we, you got plumbing, you got to have plumbing in buildings, putting in a little extra pipe that then shoots the water out that you can drink, not so hard. Tax strategies to discourage consumption of food and beverages. That was probably the most controversial of the 12 that we put out there. And you keep hearing about the soda tax and the sin tax, and oh my God, and we can't do it. And I would say to you, for 30 years ago, when those kind of ideas were being put on the table for tobacco, same kind of hand-wringing was going on. So I think this is an issue that won't go away. This is an issue that probably deserves to be always put back on the table as, well, why don't we talk about this one? If everyone agrees we don't want to talk about it, then we'll agree we don't want to talk about it. Let's put it on the table first and then agree not to talk about it. And then the social marketing that needs to happen to move things forward. On the built environment side, communities that are more walkable and rideable. And I would say at least this part of New Orleans is like that. One thing, I'm from the Dominican Republic, my family is anyway, spent all the summers of my life there, and coming to New Orleans is like being in Santo Domingo, the oldest city in the New World, that is a colonial city, and it's laid out like this city is, and so I'm feeling at home. And here's a really important one, community policing strategies. This says it's not just about eat healthy and be active. Create an environment where it's possible for people to do that. It's really, really important. And actually, we have one of those on the food side as well. Develop and implement safe routes to school programs, and perhaps New Orleans has done some of that. Playgrounds and parks that are safe and attractive. If the park is there, but it's dominated by drug-dealing folks or young people who are just kind of not participating in sports. And actually, Diego and I heard about some parks in California where the grown-up leagues have basically pushed the kid leagues out. So there needs to be some balance there as well. So it's not just about crime. Joint use of facilities. So there's myths out there, well, you can't use a school after hours because someone might hurt themselves and there'll be liability. And city council persons representative, what we learned is that's a myth, and there's an organization out there that we can connect you to that can provide, language model, ordinance language that gets you to develop joint use agreements between school districts and city councils that keeps everyone safe and creates a place where people can move their bodies and feel like they can be safe when they do so. And then some policies about minimum play space, physical equipment and duration of play, preschool, after school, and child care. Too many preschool environments, kids are just basically parked somewhere where they will look at a screen for too many hours. And the idea is, that's not good, that's not right. There's the other thing that maybe I know I didn't make clear. By the time children are getting into kindergarten, it's not that it's too late, it's that we miss some opportunities. It really, really, really has to start in the prenatal phase. Parents who might be in those communities where there might be a higher risk or a higher prevalence of obesity are parents that are going to be in the WIC program. Messaging ought to be targeted. Those are the same mothers that are going to have children in WIC, and they're going to have children in Medicaid. So Medicaid is another place where in the well child visit, appropriately structured and with the right tools, folks can make a difference. And you know what? In the interest of time, I'm going to do 2 more slides and then we're going to stop.